We're joined by Sana Beg, spokesperson and director of communications at Médecins Sans Frontières. Sana, thank you very much for being with us. Is there any clarity on the number of people who've lost their lives at the hospital in Gaza?
Thank you, Vishnu, for having us and covering this very important story. At this stage, the information is still coming in. At the moment, what we do have clarity on, and we are consistently reinforcing in light of this tragic incident, is that attacking healthcare facilities, attacking medical workers, hospitals, is a violation of international humanitarian law. It is not the first time we have been on the receiving end of such an attack. But just to reinforce here, while the facts come in, while the numbers come in, what is important for us at Doctors Without Borders to reinforce here is that medical facilities should never be a target. Medical personnel, those aiding others, should never be a target.
But you do know that the attack was not necessarily carried out by Israel at all. There is new footage which clearly indicates that this could have been a misfire from a Hamas or Islamic Jihad rocket.
Like I said, we are waiting for confirmation from the teams on the ground as well. And we are not in the business of hypothesizing or speaking or commenting on who the perpetrators were in this stage. For us, the needs on the ground are dire. It is sickening. It is catastrophic to see what we are witnessing on the ground. And what we have been witnessing are kids, women, children, families losing their lives in Israel, losing their lives in the occupied Palestinian territories. There needs to be an urgent cessation of violence on all sides so that humanitarian aid can continue. In the end, when elephants fight, it is the grass that suffers, Vishnu. And what we are seeing at this stage is blurring of lines between civilians and combatants. And humanitarian organizations like ours are finding it incredibly difficult to carry out medical humanitarian work.
No, Sana, I completely understand and accept that argument. We've seen this in wars across the world, and it's certainly the case in Gaza. That said, there is new photographic evidence which suggests a couple of things, and the reason I bring this up is because it is internationally verified, and what it does appear to show is, number one, no large crater at the point of impact. The point of impact has 2 cars which have been destroyed, 3 which are damaged. It is no more than 20 meters away from the hospital, and the hospital structure itself, though damaged, is unlikely to have seen 500 deaths. And I say this because the claim of the number of people who have lost their lives comes from Palestinian authorities. If that claim is not comprehensive or accurate, then it's a question of credibility on what is happening in Hamas, in Gaza. That's why I'm asking.
I see. You mentioned the point of impact. From our vantage point, the point of impact are civilians, patients, medical staff in Gaza, who on a very daily basis are faced with the uncertainty of what the next hour brings. I wanted to also bring in perspective here. I understand the focus on the situation that has happened at the hospital, and I reiterate that we are also awaiting confirmation and information. And I'd rather speak about what we hold true as principles to our organization, which is on first-hand witnessing.
Yes.
We only speak about what we see. We are guided by principles of impartiality, neutrality, and independence, something that is all the more important in extremely divisive situations like the ones that we're facing in the occupied Palestinian territories and in Israel. And based on that first-hand witnessing, Vishnu, what we are seeing is that in the very early days of this latest flare-up, we had supplies that should have lasted 3 weeks of medical supplies. We were wiped out in 3 days. You can only imagine with a crumbling healthcare system what the human cost would be. There is a moral bankruptcy from global communities at this stage, and we are urging all of those at a global level, leaders who are responsible for decision-making, to ensure that humanitarian corridors are open. Vishnu, I'm sure you have reported, and NDTV has been one of the few sources that has been reporting in a responsible manner on the situation, and it's exactly what we need is informed, ethical reporting on a conflict like this to inform the audiences. You may have seen that people were ordered to evacuate, to move from North Gaza to South Gaza. Let me just explain to your audience just how tiny of a space we're talking about. North to South Gaza will take you 15 minutes, the amount of time it takes you from your studio in GK1 to go to Khan Market. People have to make that difficult decision of do they stay in place, especially for those who are injured who are senile, who may have other situations, do they stay in place? Do they make that risk to go and reach the south of Gaza as well? Like the death situations, with very little time to think about what decisions to make and what the consequences could be. That's exactly what we're seeing on the ground. And to us, that is the point of impact that we're focused on. In any divisive situation, you will always have an infodemic of sorts, misinformation, disinformation, and then the facts. We have constantly operated in our 50 years of existence in these controversial spaces. To us, what matters is that regardless of what the situation is, what the facts are, humanitarian assistance should continue unabated.
Is there a real problem even now, based on what you are hearing, of armed combatants, by which I mean Hamas terrorists operating in very close proximity to civilians who are being used as human shields?
Look, we speak to our staff on the ground. We have about 300 MSF staff working in Gaza. Very recently, we had to make the very difficult decision of evacuating only our international mobile staff out of the region. And so we are relying on what we're hearing from our staff. At this stage, I cannot corroborate on what you have shared. It is not information that has reached us from our field teams.
Could you share with us then what the immediate medical situation is? We were told a couple of days back that even body bags were hard to come by. What is the situation with medicine? What are the essential supplies that you're looking at to stabilize people on the ground who are injured or unwell?
When we see power cuts in New Delhi or in any part of India, we recognize we have first had an experience, you and I, on how everything can come to a standstill when there is a power cut. Now imagine if that happens in a volatile context like what we're seeing in the occupied Palestinian territories. What we're seeing from a medical perspective is that there is a shortage of fuel, there's a shortage of electricity. Any sort of medical equipment that needs to run on electricity is unable to do so. Generators are running out of the fuel that is required for them. Basic painkillers, a scary thought, basic painkillers no longer exist. Basic medicine, having safe passage to supply essential medical equipment and medicines and such is not guaranteed. So the situation is catastrophic in that manner, egregious, something to the extent of something that we have not seen at this scale in recent memory.
Is there any clarity at all on the status of the Rafah border crossing? There's so much hope being pinned to that one crossing.
You're absolutely right. There is a lot of hope pinned there, and I'd like to urge global leaders at this stage as well, a call that we're making globally as MSF to please ensure safe passage through the Rafah crossing. Like I said, there's limited options to have humanitarian aid enter Gaza. This is one of the few, and we continue to urge and push for a humanitarian corridor in Rafah to be open.
Could you share with us any details, again, based on what you're hearing, on where those individuals, those civilians from the north of Gaza who did manage to get south, where are they staying? Are they sort of refugee camps? Have people moved into friends? I mean, is there a sense of people letting others into their homes?
Like I said, we are relying only on testimony from our field staff on the ground. At the moment, we are focused on providing psychosocial support for a lot of them as well. This information will come to us at a later stage, and we'd be happy to share that when it does come to us. At this stage, like I said, we're trying to prioritize patients on the ground and our particular staff that we were forced to evacuate.
You know, I've sort of seen MSF work around the world, in Afghanistan during 2001, in so many other places as well. And these are doctors who are, and medical staff who are, willing to put their lives on the line, and not willing to move out of areas where nobody should actually be. Could you tell us a little bit about the team in Gaza right now?
It is always a heartbreaking decision, Vishnu, when we have to move our own staff out. It is not something we take pride in doing. But we do need our medical and non-medical staff. That entire ecosystem of humanitarian aid needs to function well. And so, like I said, we had to make that difficult decision to only move those that are international staff. We have a lot of colleagues who are from the region, having to balance both personal tragedies and continuing to work in an impartial manner for MSF. We are humbled by the commitment that we're seeing on the ground by medical and non-medical staff. It is not an easy task. And we sitting in India in the comforts of our homes have really no idea the extent of the devastation taking place there.
But just so that I understand it, Médecins Sans Frontières has local workers and doctors and medics and others in areas which are being bombed, even now helping people who need help?
We do. We have doctors in the region. We've had to forcibly evacuate our international staff. A lot of the locally hired staff still remain there.
All right, Sana Beg, thank you very much for speaking to us, sharing your concerns on the grave humanitarian crisis which exists in the region. Thank you very much indeed.